of the day? Yes, we can end the TB. TB is not only today's or yesterday's problem, it is an age-old problem. You know, nearly 10 to 10.8 million new cases are found out in globally. 134 out of 1 lakh population are affected by the TB. Are you understanding? TB is mainly caused by the Mycobacterium tuberculosis. This is a 0.μ milligram size, rod shaped, acid-fast bacilli. Why it is acid-fast bacilli? It can resist the acid and the fast. This one. Mainly the TB is affecting the vulnerable group people who are on the poor economic socio-economic status, old age people, and the sometimes secondary infections like HIV, AIDS, and other infections having, that's immunosuppressive patients, or else like a cancer or any diseases which affect the immune system. TB will be coming as opportunistic infections. TB will be caused in a two form. One will be the respiratory airborne infection, and other will be the bovine tuberculosis. What is bovine tuberculosis? The TB will be coming by drinking the milk which is unboiled milk. So the breast of the cow will be having a TB bacillus. When you drink, it will affect the stomach first, and there is a bacillus will be forming in the abdomen or the stomach. From the blood vessels, it is taking to secondary to the lungs. So whenever the lungs it is going, first it will be affecting the apical part of the lungs. Are you understanding? That's what is the definition of TB. It is a formation of a tubercles and the bacillus in the lung parenchyma. Before doing to the lungs, you should know the development of lungs. You know, under 5 children are more prone to develop the TB. That is called the primary complex. The children will be getting the primary complex. Primary complex is the first infection will be affecting the TB. If you see the development of the lung, the newborn baby, once it is born, even a mature baby which is born after the 30 and 40 weeks of this pregnancy also, the complete lung will be developed in the age of 8 years. What has happened in the complete development in the 8 years, then what is lacunae in the development? In this, if you see the lungs, there will be the structural and functional unit is called the alveoli. The alveoli will be having a surfactant. Till 8 years, the surfactant is not completely developed. Are you understanding? Even I am the victim for the TB when in my young age, I was affected by the primary complex. My father was taking me from this village to the Tutukore, that is the biggest hospital, only they are getting treatment. When I was affected in 1977 or 78, there was no big TB treatment available in a primary healthcare center. But currently, all the primary healthcare center are upgraded. BMOM, CMOM, EMOM, all doctors are available. Maternity doctors, OBG doctors are available. And the first line, second line, short-term TB therapy is also available. DOTS program. What is DOTS? Direct observation, treatment and short-term course. It's available. The TB where and all will affect. I told you it is affecting the abdomen and the lungs. Is it only affecting? Except the nail and hair, any places TB will be coming. Right or not? TB bones or TB, any places in the body, the TB bacilli will be affecting. The treatment is anything different. The same drug of course you have to. The TB bacilli is much resistant, multi-drug resistant they are having. So it is very important. Government is having even giving an incentive to the people who is taking care of the TB. For example, I told you in my small age I developed a TB. Now if I currently develop a TB, one more people government is appointing, paying 1,000 rupees, and every day he should monitor my drug. He has to give the drug. So within short time we can able to. Yes. So I told you in the apical part of the portion of the lungs it is affected. Afterwards it will be developed into throughout the lungs, and because the lungs and the rectum are the highly vascular area. So completely the lungs will be developed. So there will be tubercles and baruncles or the bacillus will be this one. When the X-ray if you are seeing, there will be a dots will be there, you can see. What will happen? This affected area will be there. Any foreign body affecting ours, there will be a reaction will be there, antigen-antibody reaction. Am I correct or not? So the antigen-antibody reaction, what will happen? There will be a fight between the WBC, pathology, there will be engulfing the bacteria, and there will be a collection of fluids will be there, right or not? So if everybody may get infection, if my immune power is very good and taking protein rich, it will be going to disappear. But when it is not that, there will be the collection of fluid will be there, and there will be a overload, lung will weight will be. Then there is the 5 important signs and symptoms you can see in the TB, right or not? What are the important signs and symptoms? High fever, evening fever, chillness will be there, sweat will be there, weight reduction will be there, hemoptysis. What is hemoptysis? When there is coughing, there will be a blood will be coming down. So what will happen in this arena? When there will be a collection, it will be collected into the bronchiole, it will come. Then when they cough, when the person is coughing, there will be a sputum. As a nurse's role, you have to, this pathophysiology you have to remember, and you have to remember doing the physical examination, what is the sound, how it is getting, and the nurse's role when you are collecting the sputum is a very important nurse's diagnostic measure. It's not we do confirmative test. What is confirmative test? Is called Montague's test. Even then, we will do the sputum culture. Early morning you have to collect. So you have to tell the patients, as a nurse, you have to tell him, take a deep breath and how he has to. Simply, you are in a very hurry, saliva, you have to give it to them. You have to take a cough and you have to tell him how to cough it. In a protective cough, how he has to bring out, and you have to wear the gloves and give it to them. And the education is very important because it was that once I developed TB, finished my life. When I was developed a TB, my father was very upset. My child developed a TB, and he is asking 101 question to the doctor. Will she develop a TB again? He told she may develop in the age of young age, but it is like secondary infection. If her immune power is good, she will not develop. Are you understand? So that is the pathophysiology and signs and symptoms of TB, and you should know nursing management, what I told you, and you have to teach them some yoga. Now government is introducing every disease. Ayush has been introduced. What is Ayush? Ayurveda. What is Ayush? Ayurveda, yoga, Unani, Siddha, homeopathy. So these are the indigenous medicine, complement alternative therapies. So these all are originated in India, very famous in the foreign country. They are following and we are not following. That's why every primary healthcare center Ayush station will be fixed by the government. So you have to do pranayama. You know pranayama? How to do pranayama? Right or not? Because that's lung expansion. So once you have to develop the lung expansion, other thing. And other important education, health education, you have to divide into 5 sections in the TB patients. What are the? First is the diet. Are you understanding? Diet. Diet is protein-rich diet. Minimum he has to take 2 eggs per day, and the which is a high non-vegetarian diet have the high protein diet. So you have to motivate them to take a small, frequent, high protein diet. They have to take. Or understand? Juices and other nuts, vegetable protein also can be implemented to take to the patients. Diet and the exercise, deep breathing exercise, pranayama, and medication advice is very important. Medication exercise, you have to tell them continuous following of the drug is very important. The TB drugs are very costly like an HIV drugs. Since the government is giving free of cost, don't think it is free of cost coming. It is all our GDP they are planning. From our tax money it is going. So once we eradicate the TB, we can plan it for the next government developmental program we can plan. So that drugs is very costly. Moreover, it is not good. Once you skip the TB, I told you this is a multi-drug resistant organisms, very strong organism. You have to add the number of drugs. You know any drug we are taking, it has got a side effects. Right or not? Your body has to mature enough to take. If I have secondary illness and taking a multi-drugs and including another drug is very, very difficult. So the health education and positive therapy to the patient is very important. And the follow-up. Understand? And the X-ray and other follow-up is very important for the TB patients. And the family-oriented education is very important. The family education, either the children, hand washing technique, how you have to do, and how to discard, the sputum and other thing is very, very important. If you take community, everything in a government, TB is treated by the private, mostly 80% we get a good treatment in the government. Government is prevention in a 4 level: primordial, primary, secondary and tertiary prevention level. Primordial preventions, government has started to giving the medicine, vaccination for the kids. Right or not? At birth, BCG. What is BCG? Bacillus Calmette-Guerin. There is the injection intradermally given to the children. If you take, everybody will have in a left hand, there will be a marking, BCG marking. This is a primordial prevention to this one. And if you take primary prevention, also vaccination, health education, health awareness. And secondary will be early identification, early notification, early treatment, early referral, early admission, early rehabilitation. What is called rehabilitation? You don't need to wait the TB patient to develop the complication. The rehabilitation is a social, economical, medical measure to train and retrain the individual to lead the maximum potential of his life. So once a person is diagnosed as TB, you have to start your rehabilitation. See, if you are not doing, you can come up with a positive therapy with your words, how you can prevent the complications of TB. You have to start the day one the rehabilitation. Though the rehabilitation as a tertiary prevention, the rehabilitation goal is once you diagnosed as a hypertension or diabetes, the day one you have to start with the rehabilitation. It's not the thing, oh you developed a TB, you will die, you will get meningitis. No, not that thing. Not that thing. That's what one of my friends is calling from America. He is telling, you are taking ulcer medicine, you are more prone to get cancer. That is not the way to tell. What you tell positive word, you are attracting cancer. You will not get cancer. We have to prevent it. You will be better. If you do exercise, you can prevent it. You are not telling you will get it. You have to tell you will prevent it. Your weight gain will be gain good. You will be going for work. You will be gaining your weight. You will prevent all this once. So you have to positive approach and positive therapy you have to. So otherwise what will happen? She is very much afraid. The doctor has told like that. She is calling me from America. Will I get cancer? No. You will never get cancer. You continue with the reflective diseases with this pantoprazole medication and reduce the tension. Sleep more than it. Everything. Sleep is important. Protein-rich diet. Sleep is like a renovation of new cells. So good sleep will be inducing the good, better growth for the patient. So positive approach, positive therapy, hygiene, nutrition, education, and what are the things? Family-oriented education you have to give it to them. So the TB cases are currently it is reducing. If you do this nursing management, we can achieve the goal which we are calling that yes, we can end the TB with the joining with the government. Either you are a nurse, you are working in a government or private, whatever it may be, the nursing role is playing a very vital, important role. It is starting, you have to give it to them. So the TB cases are currently it is reducing. If you do this nursing management, we can achieve the goal which we are calling that yes, we can end the TB with the joining with the government. Either you are a nurse, you are working in a government or private, whatever it may be, the nursing role is playing a very vital, important role. It is starting from the giving BCG vaccination to treating the people. So in between, how you are. You cannot teach pranayama, you can give what spirometer. That's only cost around 120 rupees. You can tell him, blow it. When he blowing it, green or anything which is coming, that means you will motivate them. When my parents were affected by COVID, I will tell pranayama, nobody will do it. You give one device, mommy, you blow in a way that how the green ball is going up. So every time they blow, only red ball is moving, even yellow is not moving. Then slowly, green is little moving, they were very happy. So that kind of activity therapy you have to give and the multi-drug resistance you have to follow. So keep in your mind, the TB is the disease in our family member or any patients are developing. You can, as a nurse, you can easily prevent it by giving a health education in a nice manner. We can achieve the goal to prevent the TB. Understand? Understand my class about TB?
Yes,
So
madam.
will you work forward to join with the government? Yes? Yes? Yes. Any patient you have to think it's like our father, our mother. When they admit, how you take care, that is the karma. That is our noble profession. That's why it's called we can touch. Why the America, one doctor told she is calling the negative word affect the patient. So you have to positive word you have to tell, motivate them. We have got a beautiful medicines and government is supporting. Surely next year the case will be reduced from the 10.8 to at least if you are not getting, it will be in a half pay it will be reduced. Thank you so much. Thank you for the opportunity.